So welcome everybody. Good to see you or have you on this call. Just to start out, a congratulations to all of you being awardees for the Justice Reinvestment Grant through Arizona Department of Health Services. Quite an accomplishment. It was a very, very competitive process. We had 182 applications for the funds. So making it through to become an awardee is something you can be very proud of. So looking forward to seeing your work as it goes out over the next 1 to 4 years. And, we're here to be impactful for our communities throughout Arizona. And I am personally very excited to see all the work that's going to be done by all of the awarded groups. With that, this is the orientation meeting. So I'm going to turn it over to Lindsay, who's put together this slide deck to really talk about what to expect moving forward throughout your grant period. Lindsay?
Good morning, everybody. Yes, hi, I'm Lindsay Hoffman. I feel like I've been emailing all of you a lot. Grants coordinator here with Vitalist. So let's get started. So, first things first, if you have any questions, feel free to throw those in the chat. Michelle is also going to be monitoring that in case we have any pertinent questions that need to be answered in that moment. Otherwise, we have space for discussion at the end. Obviously, we have the closed captioning on, and this is going to be recorded. We'll have a link available for everybody to review should you need to look back at it. And then for anybody maybe in your organization who wanted to be part but couldn't, we'll have that available for them. And also, if you need this in Spanish as well, we have that email link there for you to reference. So today, the purpose of this orientation, we're really going to be going over, everybody's awards, some reminders about terms and conditions, talk about the deliverables, reporting, understanding budgets and expenditures, and then the next steps in this process. And then again, as well as having some space for some questions and answers. So again, congratulations to the 25 of you, our grantees. We're very excited about all the work that you will be accomplishing under these grants. So just really excited to be working here with all of you. So we'll have some time too for everybody to get to know each other, but just wanted to recognize the 25 of you. So we're going to start again talking real briefly about the contracts that we're executing with each of you and some of those award requirements. So the different components in your award, obviously there are the required trainings and meetings, this orientation being the first one, so you can mark that off the list. Then the actual contracts, including terms and conditions. We're going to talk a little bit about those certificates of insurance that I've been messaging with everyone about. We're going to talk about then the 3 types of reporting that's included, including those monthly expenditures, quarterly progress reports, and annual reporting. So our trainings and meetings that are required of you, obviously this first one is this orientation meeting. So you've marked that one off the list. We're also going to be holding monthly check-ins. We hope to be working very closely with each of you to help facilitate your work in any way that we can, make sure everything is going according to your outlined deliverables and you're meeting all of your program goals. And then the third component is going to be these community of practice events. So those are hosted by ADHS. The next one is going to be occurring November 20th. Obviously, that's fairly short notice. And so the first one that's really going to be required of you to attend is February 19th, and that's at 10 a.m. These are virtual. It's a quarterly event that occurs on the 3rd Thursday of the month. So there will be some additional information about those coming out. So the contract terms and conditions and then deliverables. So of course there were the terms and conditions that were included in everybody's, when you initially applied for the grants, there were the terms and conditions. So we just encourage you to, again, review those in more detail, but we wanted to highlight a couple points just as some reminders. So the first one being with your records and any audits, you are required to retain all of the data and any other records related to these grants for a period of 5 years after the completion of the grant. At any time, you would need to produce legible copies of these records, and they're should always be available for inspection by the state at reasonable times. Another important thing that we want to point out is about equipment. So if there was equipment acquired through the expenditure of these grant dollars, that is property of the state, and it's property of the state being managed by ADHS. So at the termination of your grant, that property needs to either be returned to them, or they will determine how it needs to be disposed of. And so again, if there's equipment being purchased under this, that is property of the state. All marketing materials have to be submitted for approval prior to use. That includes anything where you're going to be using logos from ADHS, Vitalis logo, any materials that you're going to be producing under this grant for this grant. Again, those materials for marketing need to get prior approval before distribution. A note about funding: all of this funding is subject to change based on failure to spend the funds effectively, if you're not complying with grant requirements, or if for some reason there is a change in the ADHS available funding, then our funding is subject to change. If you, as a grantee, then were to organize a sub-grant award, you cannot enter into that without prior approval from Vitalis. Any kind of subcontractor, again, you would need to have a contract in place with them, referencing all those same material and applicable terms that our grant with you has, so that that subgrantor would be liable for also being included in monthly billing and reports. And they'd also need to be part of the monitoring process and our monthly check-ins. So really, if there's, as our grantee, if you're going to have any sub-grantees, we need to be involved in that process and make sure that they have all the same type of information, terms, and conditions that you do in your award. And then deliverables of everybody's grants, our programs and services, making sure that they're culturally and linguistically appropriate and inclusive of communities and individuals with disabilities needing accommodation. Data collection, there's going to be there's annual reporting on your demographic data. And as a grantee, you're responsible to make sure that you're onboarding new staff, managing your budget, evaluating these activities to meet your metrics, and then there's going to be the required reporting. And then annually, there will be a programmatic evaluation just to make sure everybody is meeting or making progress on the goals and objectives that you outlined in your proposal, that you're reaching and providing services to the targeted populations, and then also just monitoring the satisfaction survey results that you get from your participants and making sure that we're meeting those goals and objectives. Insurance, we've spent some good time talking about this one with, via email. So obviously there's several categories that we needed to make sure that you have certificates of insurance for. These are the limits between the commercial general liability, business automotive. There has been a lot of questions about the business automotive if your organization isn't having any, if that's not included in your work. So if you're one of those groups that has asked about that, we're still getting confirmation from the state of so hold for that explanation. So more to come there if you are one of the groups who've had questions about that. And then the other insurance that we need is that workers' comp and employee liability, again, and with the limits. And the biggest requirement on these has been making sure that you're listing ADHS as additionally insured. Some folks have just been sending, that certificate of insurance showing that you have the insurance limits, and that's excellent, and we appreciate that, but it is also critical that we make sure that the state is listed as additionally insured for the purposes of this agreement. And reporting. So with our reporting, there's really three categories. We have the monthly reports, there are some quarterly ones, and then the annual. So each month, the big one is essentially your expenditure reports. So if we're often going to refer to these as the CERs, contractor expenditure report. And so this is just based on the budget you provided to us. It focuses on each of those categories. What was your approved budget? And then what are the expenses from that month? We want these to be submitted no later than 30 days after the end of the month. You need to include all that supporting documentation for the expenditures made during the invoice period. We'll be going over, we'll be scheduling calls with each of you to go through more about this process, but just as a reminder, this is the form that you should be expecting to complete each month with all of the expenditures from that month being organized by category for each reimbursement. For quarterly reporting, you're going to have a written progress report, detailing all of the activities that you completed that quarter. Obviously, for our first quarter here, October to December, we're partially through November, so it's going to be a shorter report than most. But so each quarter, no later than 30 days at the completion of the quarter, we need to get that written report from you. We're going to work with each of you to create a template showing what your measurements are and the goals that you're working to accomplish to help expedite that process. And then the other part of quarterly reporting that you need to submit is the participant satisfaction surveys. In terms of annual reporting, again, we'll have a template available for everybody no later than 30 days after the last quarter of the grant year. You want to include a copy of those participant satisfaction survey results, and it's really the summation of all 4 quarterly progress reports. So with each quarter, so when we come to the 4th quarter, obviously you'll have your quarterly report, and then the annual report is really just going to take those four quarterly reports, and you get to summarize what you've accomplished for that year, include the copy of the satisfaction survey results from the previous quarters, and then you're also going to be adding in the demographic report. Budget and expenditures. So we're going to have Roy step in for this part.
I'll take over here. A lot of this information is going to be also from those of you who came to the information session before you applied, but we want to just reinforce some of those items. You all submitted this as part of your application, but an annual budget and work plan. So those are requirements, but you actually already submitted them and they were approved. If you are going to be updating, or if at the end of each year, if you are significantly underspent or overspent, a buy list may request that you update your budget for the remaining year or for the upcoming year. So that may or may not occur depending on how tightly you're holding to your original approved budget. But just know that you'd be required to complete an updated budget if requested at the beginning of each year. All activities, this is a cost reimbursement grant. All activities and procurements funded through the Justice Reinvestment Grant need to be aligned with the budget work plan. So, what you're spending needs to be part of the approved work plan. Getting into some very detailed things, we talked about this in the informational session. Gift cards, can be no more than $25, and you must have a tracking system in place to control the benefits per beneficiary, right? Obviously, gift cards are one of those areas where a lot of fraud can occur, so this will be watched fairly closely. So just keep in mind, no more than $25, and you must have a tracking system in place for the distribution of those cards, who gets them and for what purpose. No funds for lobbying. For travel, you must have a mileage log for mileage reimbursement. Contains the date, beginning and ending points, the miles driven, and the purpose. Okay, right now, the currently approved reimbursement rate is 67 cents per mile. So please do not exceed that in your expenditure reports, because we'll put it back to you to limit it to 67 cents per mile. In terms of equipment purchases, we kind of talked about this earlier on, where purchases made with these dollars are owned by the state, until the end of the grant period, when ADHS will make a decision on the disposition of those assets. So they could take them or they could grant them to the nonprofit, to the awardee, but it really is up to their discretion. Purchases of capital equipment, so these are single purchases of 5,000 and more, need to be approved before purchasing. So please do not purchase any single piece of equipment worth more than $5,000 without checking with Vitalyst first. And any purchases over 250 must be tagged with an asset tag. So for those purchases, you can make them, but please identify those as you're turning in your CERs each month, and we'll make sure that an asset tag is issued by ADHS. As you were developing your budgets, you were allowed up to 15% of direct program expenses at indirect cost. So that can, when you are, whatever your approved indirect rate was as part of your award, when you are submitting your CERs at the end of each month, you may add that indirect expense into the reimbursement request. We do keep a list of all employees that are employed through the grant. So if you, and over the course of the grant, you obviously may have changes in personnel. So please identify within 30 days of hiring those individuals to Vitalyst, who their name and what their scope of work is, so that we can keep our records up to date. And people who are going off, please also identify those individuals so we can keep that list current. Budget reallocations, there may be a course over the next, over the grant period, since it's several years, where you will determine that money needs to be added to one budget category and removed from another budget category. If it's less than 10% of the approved annual budget, you do not need prior approval. If it's going to be over 10% of the annual budget, you need to submit a budget change request. So just let us know and we'll give you the form, very simple form, where it's going to be the originally approved budget, the requested revised budget, the change, and then a field for the rationale behind the change. As a reminder, these are detailed manuals, but all funds must be spent in accordance with the State of Arizona Accounting Manual. So you can, there's a link here that gets you to that. But if there's any detailed question about spending funds, this manual will likely have it. So you may go there. You may also submit a request to Vitalyst, and we'll get you an answer as well. For those of you who have requested working capital or advanced funds, many of you don't need this, but Vitalyst is making this available. So we will calculate, remember, this is a cost reimbursement grant. So you will be working for 30 days. You'll be completing the expenditure report at the end of 30 days, and we'll be assisting you with that. Then that will be submitted for reimbursement. Vitalyst will turn that around very quickly, and then Vitalyst will in turn turn that around to the state and wait for reimbursement. If you believe that working through 30 days will be difficult from a cash perspective, Vitalyst has a form you can request an advance. So, and Vitalyst has agreed to advance up to 45 days of expected expenditures. So basically taking your annual budget, dividing by 12 to get a monthly spend rate, and then multiplying by 1.5 to turn that into a 45 days expected expenditure. The expectation then is that at the end of each month, you would immediately turn around, create that expenditure report, get that turned in by, say, day 10, in which case we would be able to reimburse that month, to reload that cash advance within the 45-day period. So be a little extra work to make sure that you get your expenditure reports in quickly at the end of each month. But this way, if you don't have available cash to really fund and wait for the reimbursement, this is a method for you to get that money up front. But recall, all funds must be used for only allowable expenses under the grant terms, and any funds that are used for non-allowable expenses must be repaid immediately. But just keep that in mind if you are thinking that this is going to be a cash strain to do a cost reimbursement grant, we're here to help and we want to. So reach out and we'll be able to get you the forms to apply for that cash advance. And I'll turn it back over to Lindsay.
All right, so next steps. Later this week, you're all going to be receiving an email. We've essentially created this online platform through Power Apps to help with the reimbursement process and creation of those expenditure reports. So you're going to receive an email. It's going to have a title essentially saying, you know, Power Apps Grant Platform. It's going to include your username, your password, and then a link to the actual platform. We're going to be reaching out to each of you to walk through the platform just to make sure you're comfortable with it and understand the ins and outs for submitting all of those reimbursement requests and really understanding the full CER form and what it looks like. And so then on this next slide, this is just a visual of when you access that link for your account. This is going to be the page essentially that shows up. It's going to have the name of your grant with your specific grant numbers. And then it has these 4 categories between invoices, those expenditure reports, a space for the documents, and reporting. So again, we'll walk through this with each of you. Just wanted to make you aware that this is the next step. And then Roy?
Yeah, but before we leave this slide, can you go back real quick? This will be something that will be new for basically everyone, even if you've had cost reimbursement grants in the past. We're trying to streamline this process, so we are interested in any feedback. But effectively, when you click on invoices, this will allow you to, as you are operating your grant and as expenses are paid, you can just go to your invoices, you can upload that image and then identify what budget category it goes within. That will automatically be sent internally here for approval so that the backup will be reviewed to make sure it's a reimbursable expense. So you'll know right away whether it's approved or not. And then at the end of the month, when you go into and click on the expenditure reports, that will show every expense that's been submitted and approved. And literally at that point, you can just click create your expenditure report, and it will include all of the approved expenditures through that month or through that date. So we're hoping this really streamlines the process. You don't have to collect everything and wait till the end of the month and put all this documentation together. You can submit it as you are going through the month, whenever you have an opportunity to upload those invoices into the system. And then the monthly reporting will literally be done for you with all of the backup. So we're excited to have this incorporated, but always open for thoughts and recommendations to improve this process.
And the other thing about it that's really helpful is it will also show you once you've submitted those expenditure reports where you are in your total budget. So it breaks it down by category so you can see in real time, you know, between what you budgeted, where you are in terms of spend. So it's infinitely helpful just to make sure you're staying on top of your expenses. And with that, we have some space for questions. The only other thing that I did want to mention is that I saw Jennifer was on the call, so I don't know if she wants to come off mute for a moment and talk about the, community practice events. So Jen, if you wanted to say anything about that.
Hi, Lindsay. Hi, everyone. My name is Jen Vasquez-Dishram. I am with ADHS. And I am very excited for all of you and looking forward to hearing about a lot of the work that you're going to be doing. As far as the community of practice goes, yes, the next one is on November 20th. However, it is short notice. And what I like to do is I like to try and have a quarterly virtual meeting with all of the partners, more as a networking, so that you can get to know some of the other organizations that you may or may not be working with currently, and be able to share some of that work, learn from each other, really be able to grow what you're doing. So the next community of practice, as Lindsay shared, will be in February. And what I would like to do is create a slide deck, and I will share all of this as we get closer with you, is just share a slide deck with you and have you complete 3 to 5 slides, basically just your contact information and something about your program, some of the work that you're looking to do, maybe even some of the challenges that you think you may or may not be facing, and some of the information that you would like to share or get help with. So that's coming up in February. Thank you, Lindsay.
Perfect. Thank you for that, Jen. So yeah, time for some question and answers. I think starting with those in the chat, the first one, the purpose of federal funds and expenditures, are we considered subrecipients or contractors? So again, this funding is from the state, it is not federal. And then I don't know
I'll
if
hit a couple
Roy.
too. In terms of, yes, matter of fact, I just am going through this at Vitalist as well with the renewal rates for insurance. Changes are hefty. If it is going to throw off that 10% of your total annual budget, then we'll have to do a budget revision. But however, I'm thinking even with the large increases in the health insurance lines, I don't know that would throw you necessarily off more than 10% of your annual budget. But yes, if you're concerned about that, then absolutely let's talk about it, and we can put in a budget revision request once you know what the firm numbers are. In terms of public announcement, yes, Vitalist will be putting out a public announcement. I don't know if ADHS will as well, but Vitalist certainly will be. We were waiting just to get the final approval on a couple of the awards, which we now have. So that will be going out probably today or tomorrow on the website. So there will be a public announcement of that. Around continuing on this guidance around sharing the grant award, as long as you're not using, I think, and I don't want to speak for ADHS, but if you're not using their logo, sharing out on your website or social media that you are an awardee is absolutely fine from my perspective. We're going to be announcing that as well.
Yeah, Roy, just to add to that, so with your any of your marketing, what we tend to say is that if you're going to send out something or share some type of information, you would just have the ADHS logo there, just as a partner with you, even though we are kind of we are seeing this grant, we're the grantee, or excuse me, grantor. And so we have worked closely here with Vitalist, and Vitalist has worked with each and every one of you very closely and made those decisions. And so we are just here as a support mechanism and just kind of as the grantor.
So Jen, if they want to put out on their social media that they're an awardee, funded through ADHS, should they be submitting those to get the approval to use the ADHS logo, or is that an announcement like that? Does that need approval?
No, that doesn't need approval. Basically, if you're just announcing your award, my take on that would be that I would think that they would recognize Vitalist as well in that. So an ADHS/Vitalist awardee is how I would say that.
Okay. So approving marketing materials, yeah. So please just, if you submit that to, and we'll have an email coming up here, JRG for Justice Reinvestment Grant at vitalisthealth.org. If you submit that there, we'll quickly turn that around. We'll work with ADHS to get approval and get that back to you. Insurance certificates. So why must the state be listed? They're ultimately the funder, and these are part of their procurement rules. So listing them as an additional insured is simply a requirement of the state, protecting themselves since it's their funds that are being dispersed. Representatives to attend events. Not necessarily. If you send out an invite, though, I know that Vitalist staff and TAP AZ staff does appreciate attending some of those, so they might go out. But typically, I wouldn't expect it. But as I said, we have a lot of people just interested in the work, and they do show up at those types of events. So for Brian, can you kind of share a little bit more what you're asking here for the records and data that will be owned by the state? So obviously the quarterly reports, the satisfaction reports, the demographic reports that you're giving to the state will be owned by the state. They will not have individual records, protect any kind of protected information of your clients, in their possession. So can you kind of share a little bit more what you're looking for there?
Yeah, well, you kind of touched on it. I was more thinking more about the area of cultural data and then clientele data. So
Okay. Yeah, just what you submit is what they will have.
okay, thank you.
Jen, did you have additional to that?
Yeah, I was just going to agree with you there, Roy. So basically, Brian, any of your reports that we get, if they are, let's say, you have Native American and you are working with a particular group of people and you put that in that data, you had 30 individuals attend an event that were Native. That's what we're going to have. We're not going to have their specific client information. We're only going to have the numbers.
Awesome. Okay, thank you. Yeah, because like I said, when we first initiated this grant and started pursuing it, one of the big asks or one of the target areas was our area in particular, northeastern Arizona. So again, really looking at that and how the grant has, I guess in a sense, the limit has decreased over time. So again, looking at that, we're really now seeing how the funding that was provided is going to really enhance our program in certain areas. So one of them is mostly, I know the state and at the national level, they're looking for data on our reservations and things like that. So again, just kind of looking at those areas. So thank you.
Definitely. No, that's not what we're looking for here. We're just saying that whatever it is that you're going to share in your quarterly reports or your annual reports, that's what will be on file.
Yeah. So a few questions here around the dates with the grant reporting and whatnot. So the first report will be for the quarter ending December 31st. So basically it's only going to be a month and a half worth of work. And that will be due by January 30th. So it should be a very short report. The annual report is not based on calendar year, it's based on grant year. So the annual report will not be due until after September 30th. So basically in the month of October will be the first annual report after the fourth quarter of the grant. And in terms of the dates to begin billing, so as soon as you have assigned, so you've gone into the portal and agreed to the terms and conditions and the insurance requirements have been submitted to Lindsay, you're set to go. So yeah, so that's the start date, the one that just came up. The start date is as soon as you get the go ahead from Lindsay that your insurance is turned in and you've gone into the grant portal and accepted the grant. That's the date that everything begins to be reimbursable. Yeah, so the primary contact, and this will be at the end too, for right now is Lindsay, but there is a right here that the jrg@vitalisthealth.org that will get into whoever is appropriate. So Lindsay or Michelle or any other member of the team, if you send that to Justice Reinvestment Grant, jrg@vitalisthealth.org, that will get to the right person. And actually, after this meeting, if other questions come up, please email that email and we'll get you responses as quickly as possible.
And just as a reminder, after this email, the recording will be posted and the slides will be shared. I'll send everyone an email and it'll be on that website. There's on azjusticereinvestment.org.
So everything you're seeing here will be available on the Vitalist website at, yes, what's the URL? Arizona Justice,
Let me
azjusticogrants.org.
verify. I always forget the exact, even though I've typed it a million times. azjusticegrants.org.
Paula?
Yeah, I'm sorry. I was typing and I was typing the notes and I didn't quite catch on the marketing materials. Does everything also go to the JRG address for marketing materials?
That should be the easiest. Yes, absolutely.
Okay, and that would be, and again, sorry, I just need the clarification. So if we were to say, hey, this is the work, here's a picture, here's what the work we're doing thanks to the Just Reinvest grant, we need to put the state logo on that as well. Is that what you're saying? Or and if I don't want to tie everybody up, so we can always talk about that individually if I'm getting too complicated.
Yeah, so if the work is being funded by the grant and you're putting out marketing materials that are funded by the grant, then yes, that should be submitted for approval.
Okay, thank you.
Kate?
Hi, thanks. At one point you talked about sub-grantees and subcontractors, and I got a little confused with both of those terms. We're not granting again the information that's been given to us, but we do contract with facilitators and interpreters and things like that. Is that something that needs to come through the state?
No. So if these are simple contracts for a defined scope of work, but if you're actually for your work, so it's kind of like, is it your work or are you subcontracting for a piece of the kind of the broader scope under the terms of the grant? So the ones you're describing, no, that's you contracting for a piece of work you are doing. So kind of think of it more, if someone could look at it and say you are taking a piece of your deliverables and giving it to somebody else to accomplish, kind of thinking in terms of subgranting, that needs prior approval.
Thank you.
Lou?
Hey there, this is Lou with Coaches Harm Reduction. I have a question about the participant satisfaction survey. We do an annual point in time survey already. I noticed that you guys were asking for the satisfaction data like on a quarterly basis. Would it be okay to give that to you guys on an annual basis instead of like changing our survey process? We could kind of just like incorporate what you guys want from the satisfaction data already into our annual survey that we have.
Yeah, my recommendation on that, Lou, is can you send us like what the questions are, and we're happy to be intermediary with ADHS on that and say, we'll work for, what you're feedback you're looking for.
Okay, yeah, I'll send an email with our materials.
Okay, that'd be excellent. Thank you.
Okay, perfect. Thanks.
The answer is, yeah, we answered this question that just came through. So using the ADHS logo and Vitalist logo to announce the grant, absolutely. And it looks like questions are slowing down, so I don't want to keep people on longer than necessary. I really do appreciate everyone being online this morning. As we said, this is recorded, so you can come back and listen to it. Also, the slide deck will be available for you to go through to find this contact information. Always feel free to email that email address and let us know if you have questions or thoughts, comments. We're open to all of that. And I will give you the rest of your day back. Thank you, everyone.
Thank you.
Thank you.
Hey, thanks, everybody. Hey, I don't remember if I heard the response about a public announcement coming from Vitalis or ADHS about the grant. Is that something that?
Vitalis will be issuing one, and then I'm not sure about ADHS.
I'm not aware that we will be putting out any other announcement. I know that we're waiting on Vitalist.
So we'll share that, and then we can share it with everyone so you have a copy as well when we post it.
Okay, perfect. Thank you. Thanks, everybody.
Thank
God
you.
bless you guys. Thank you guys so much for the service and walking us through this.